convenient for you. We'll be having one-to-one doubt clearing sessions also, which is student-friendly approach and a safe learning environment. You can ask any kind of doubt at any point of time, and it will be cleared aptly. We'll be provided with hard copy book sets for in-depth coverage, and it will be by our experienced educators who will guide you through the concepts, answer writing skills, study plans, and many more. And you'll be having a question bank where you'll be provided with 3 levels of expertise from beginner level to expert level, customized question banks for Proff exams, NEET PG exams, and FMGE exams. You'll be having practical classes also where you'll be having hands-on experience on your practicals so that you can face your examiners in practicals and viva OC with complete confidence. For all this, you will be provided with 4 subscription plans. Foundation plan, which is available at 19,999, and a advanced learning plan of 6 months for 32,999, and a complete learning plan for 12 months for 59,999. And we do have a complete ultimate plan which covers the complete MBBS course, that is for 1.9 lakhs. That is for 4 years. With this, we'll be not to worry. We have one more important thing, that is we'll be having a discount code for all these things. Okay. We'll be discussing our first question today. Before that, I'll be launching the poll. The first poll is launched. A rural community health clinic has reported an increase in cases of night blindness among children. This prompts a detailed investigation to assess the prevalence and impact of vitamin A deficiency. Okay. Long essay. Describe the methods of assessment of nutritional status of a community with their merits and demerits. Here we are assessing the nutritional status of a community, not the individual. For individual, we had so many methods like height for age, weight for age, height for age, BMI, mid-arm circumference, all these things. Now we will see what are the parameters or the methods available to assess the nutritional status of the whole community. Okay. The nutritional status is why do we do this nutritional assessment of the community? To obtain information about the prevalence and geographic distribution. Okay. And it is also used to identify the high-risk groups or high-risk age group, you can say, or high-risk gender, you can say, who are actually affected by the nutritional deficiencies. And it also plays a significant role in redistributing the resources, making policies and recommendations, and implementing the corrective measures. Corrective measures is again redistribution of resources. We have 2 methods, that is direct method and indirect method. Direct method is again anthropometry, biochemical and lab investigations, biophysical and radiological examination, clinical examination, dietary survey, and functional assessment. Indirect method include vital health statistics and ecological factors assessment. Okay. Anthropometry includes, these are all the basic ones which you can easily write. The moment you remember anthropometry, it includes all the measurements of the human body. Body mass index, BMI, linear dimension, that is height, head circumference, chest circumference, subcutaneous body measurement, fat measurement, that is using vernier calipers, and muscle development by mid-upper arm circumference. Okay. All this we have learned in the previous classes. The same thing is getting repeated in the nutritional assessment of community also. What are the merits of anthropometry? Easily carried out without much technical knowledge is required. Anyone can take the measurements. Easily interpreted if you are giving the, for example, mid-arm circumference more than 13.5 is normal. 12 to 13.5 is indeterminate. Less than 12 is something you have to say that there is a deficiency or protein energy malnutrition, or any that is not up to the mark. Okay, this does not require great science so that it can be interpreted easily, and not much it's expensive, can be hardly you require a weighing machine and a stereometer to measure the height, and a measuring tape to get the circumferences, head measure, chest circumference, head circumference, and all. Faster, not much time consuming, it is very easy to do, and this can be done in any remote village where no facilities are available, and it has no side effects on the individual. Apart from the psychological, if the someone says that I am overweight, apart from that, there is no side effects. Demerits, the results may be accurate if the instruments used are not may not be accurate if it is not calibrated. So every equipment needs calibration, including the biochemical if you are doing in the lab. And this may not be conclusive method. You might require another methods to reconfirm it, and standards needs to be revised constantly because of the change in the cultural and the economical availability and per capita expenditure of the individuals. Things get changed day by day. Coming to the biochemical assessment, we have serum albumin level, iron, folic acid, vitamin B12. The gist of this is biochemical assessment gives you what actually the community is deficient of, or how much of my people are in diabetes mellitus, how much are how many people are having dyslipidemia, how many are suffering from vitamin B12 deficiency, how many are from B6 deficiency, how many are uh, having triglycerides or only cholesterol high, or it is only familial triglyceridemia is there, and how many have landed up with heart disease. All these things can be assessed with biochemical assessment. So it gives the specific nutrient which is deficient in the community. Okay. Next we have what are the what are the limitations of this? Time consuming and expensive. Every test need to be done that requires reagents, electricity, equipment. All these are expensive. You can't do it on a whole population or a larger population compared to the anthropometry. Need experts or trained people to run the tests, and you need trained people to interpret the tests also, pathologist, biochemist, and it is an invasive method. You can't ask sample just like that. There must be a reason for taking a blood sample. Coming to the biophysical, that includes radiological examinations also and cytological methods also. Okay, if you are getting more cases of what you say osteoporosis or osteoarthritis, you might say there is increased cases with calcium deficiency in a particular area. If the radiology department says we are getting too many cases of osteoporosis, that might say that there is a cases of calcium deficiency in the community. Okay, clinical examinations. Why this can be detected only by clinicians, like in case of rickets, there will be an increased line of density at the long bones in the radiological examination. Infantile scurvy, again, ground glass appearance in the bones due to loss of density. Beriberi, there's increased cardiac size. Changes in bone also occurs, like fluorosis. Cytological tests like buccal mucosa nutritional status, again it will indicate. And these examinations help reveal vitamin A deficiency, dehydration, or febrile conditions. Too many fever cases, too many night blindness cases. All these things give a specific deficiency identification. Okay. What are the merits? The results are more accurate and can be used as supporting data, but you can't do it on a larger population. Limitations are you need equipment which is expensive and need trained people and technical people to interpret the data. and you can't take the equipment to the people where they are staying. You have to get the people to the location where the equipment is located. Clinical assessment, again, when the child is coming, or you can go this and do it in the field also. If there is a loss of subcutaneous fats and can or hollow cheeks, then you say there is a protein energy malnutrition or decreased fluid intake or dehydration. Hair, again, easily pluckable, alopecia, brittle hair, corkscrew, again, deficiency of proteins, vitamin C and biotin. Nails, spooning is there, again, iron deficiency anemia. Transverse line, protein deficiency. Dry and scalpy, flaky paint, A and zinc deficiency. If there are nasolabial seborrhea, essential fat, riboflavin, fatty acid deficiency. Pallor, again, iron, follicular hyperkeratosis. All these are associated with deficiency of specific vitamins or micronutrients. Okay, we have a long list of clinical assessment from head to toe. Extremities, again, edema is there, protein deficiency. Ataxia, again, protein deficiency, B12 deficiency. Muscle pain or joint pain, you have calcium deficiency, phosphorus deficiency. Hyporeflexia, again, B complex deficiency. Coming to the thorax muscles, rosary, atrophic, decreased grip strength, all related to vitamin D. Neurological signs, dementia, thiamine, folate, phosphorus, niacin, thiamine, all the symptoms are signs are associated with the micronutrient deficiencies. Eyes, again, night blindness. This will be reading the one of the questions. Photophobia, xerosis, conjunctival inflammation, and xerophthalmia, vitamin A deficiency. Okay. While examining the mouth, if you have glossitis, you have B complex deficiency, bleeding gums, decreased taste or smell, niacin deficiency. In the neck, examination, goiter, iodine deficiency. Heart and chest, high output failure, thiamine deficiency. Abdomen, ascites protein, hepatomegaly protein, lichen, kwashiorkor. Merits, it is a relatively inexpensive. Field equipment or lab method is not required. Simplest, gives valuable information to public health workers. But what is required? Proper trained personnel. You might require a doctor or at least a trained nursing staff to identify these signs. And there may be overlapping of signs, which is again confusing the diagnosis, where you might require a confirmation test. The procedure is non-invasive and cooperation subjects can be achieved easily. The other method is diet survey. That is, yesterday we have seen the list of diet surveys. This also you can include that answer. Food weighment method. You can go to every family and ask how much of food they have consumed today. Or before they start cooking, you can take the weight of the food, dry food which they are used for cooking. Or 24-hour recall method. You can ask how many chapatis or how many rotis you had yesterday afternoon. How much katori of sabji you had, how much katori of dal and how much of rice you had, all these things. Diet history method, again they have to write it down, similar to somewhere like this food diet dairy method. Okay. Expenditure pattern, like how much they are buying per month. Food inventory, again, what all are they buying? Food balance sheet, what is left after the month after buying? And food frequency, how frequently they are consuming eggs, how frequently they are consuming milk, how frequently they are consuming non-veg, how frequently the fish is consumed, to say that omega fatty acids are being consumed. The most common expensive method in this chemical analysis, that is taking the blood sample to know what food they have consumed. Okay. Next, we have functional assessment. Again, we have a long list in this. What function you want to assess in this? You want to assess the microscopic level or the macroscopic level. Okay. Usually, microscopic level is assessed. We'll go somewhere which is easier, that is nerve function. How will you assess the nerve function without doing any invasive test? One is vision, hearing, taste. Apart from that, sensation. Okay, all these give your nerve conduction test. Okay, this does not require any expensive equipment to test these nerve functions. Okay, whereas structural integrity, host defense, transportation of intestinal absorption, plasma tissue transport, hemostasis, all this you require to be done in the hospital setting. But for this, you don't require a hospital setting. Okay, this is one of the functional assessment. The other functional assessment, what you can do is range of movements in the bones, gait. This can be done as a functional assessment also. Okay. Next, we have indirect assessment methods. Those are vital statistics, measures of morbidity, that is incidence and prevalence of diseases, infections, diseases, disorders, all like diabetes, hypertension, cancer cases, night blindness cases, respiratory infections, acute gastroenteritis, all these things. Measures of mortality, that is infant mortality rate and perinatal mortality rate, are they directly have an effect on, or you can say they are the direct results of community nutritional status. If the community nutrition is good, I don't we expect that infant mortality and perinatal mortality should be low. Okay. We have assessment of ecological factors also. This include conditioning infections. Ecological factors in to say that it is because of the environment which the individual or the community is staying. That is infectious and nutrition cycle like we saw yesterday. And we have community associated infections with malnutrition, most commonly TB, whooping cough caused by pertussis, diarrheal diseases and dysentery. Again, viral measles, parasitic infections, malaria and ascariasis, protozoal infections, that is amoebiasis. And there are several cultural influences which also lead to the nutritional changes of the individual. There might be only vegetarians staying in the particular area. There is a deficiency of omega fatty acids in them. Okay. There might be non-vegetarians only staying in a particular area. They might be prone for more infections. Okay. And meal pattern, food attitudes, prevention, all these depends on cultural influences. Socioeconomic factors, again, whether it is a village or semi-urban, urban, or where the underground drainage facilities are available, sewage facilities are available, all these things. Okay. With this, we have completed the long answer. So I will stop the first poll and we'll start the second one. This is the second poll which has been launched. It will be there for 15 minutes. Coming to the short answers, pasteurization of milk and test to verify them. Okay. What is pasteurization? Pasteurization is defined as heating of the milk to such temperature and for such period. Temperature and time, two T's are important, required to destroy the pathogens that may be present while causing minimal changes in the composition, flavor, and nutritive value. Nothing else of the milk gets changed, but the pathogens are killed by raising the temperature or changing the temperature and for certain period of time. Okay. There are three methods which are commonly used. First one is Holder method. In this process, the milk is boiled at 60 to 63 degree, 63 to 66 degree for at least 30 minutes, and it is rapidly cooled to 5 degrees Celsius. Okay, this is very difficult for what we say larger communities. or the higher demand places or large supply areas, because boiling 30 minutes takes time. 30 minutes is a huge time, and getting every batch of milk for 30 minutes is a very time consuming process. Okay. Hence, this can be used in small or rural areas. In larger cities, it is not much of use. Okay. It is 66 to 63 to 66 reduced to 5 degrees. Okay. The section we have high temperature and short time method. Again, milk is rapidly heated to a temperature of almost 72 degrees. Okay. And cooled before that, it is at least for not less than 15 seconds. Then it is rapidly cooled to 4 degrees. Okay. 72 degrees coming to 5. Here it is 63 to 66 coming to 5. Here it is 4. Sorry, it is 4. 72 to 4. This is widely used, and very large quantities of milk per hour can be pasteurized. What our dairy uses is this method. How do that it is rapidly cooled? By nitrogen. Okay. The other last third method which we have is known as ultra high temperature method. In this, the milk is rapidly heated, usually in two stages. Okay. Second stage is at 125 degrees Celsius only, but under pressure. It is done only for few seconds, at least for 5 to 6 seconds, and they rapidly cooled and bottled as quickly as possible. This is ultra high temperature method, but it is not used anywhere in India as to my knowledge. Okay. I have seen in states like Karnataka, Maharashtra, Punjab, Assam, uh, Haryana also, but this is the commonest method which has been used till now. Tests to verify this, we have three tests, that is phosphatase test, standard plate count, and coliform count. Phosphatase is widely used to check the efficiency of pasteurization. What do we do in this? It is based on the raw milk that containing enzyme called phosphatase. Okay. Before pasteurization, this is present, but this gets destroyed at a particular temperature, that is at 60 degrees. That is why when we see in any of these three methods, none of the heating temperature are less than 63. The least temperature is 63. Okay. So at 60 degree for 30 minutes, phosphatase is completely destroyed. If this is destroyed, that means there's no phosphatase left, and if it says that it is present, that it means that inadequate pasteurization of raw milk or addition of raw milk is there, contamination. Other one is standard plate count. Bacteriological quality of pasteurized milk is determined by plate count. By how? By culture. Okay. At least 30,000 bacterial count per ml is required to say that the milk is not pasteurized. Okay. Coliform count. Coliforms are usually destroyed completely by pasteurization. If they are present, that means the milk is not pasteurized or contaminated. Okay. I think three tests and three methods, easy to remember. Next, we have food adulteration examples. What is adulteration? Adulteration is defined as addition or subtraction of any substance to or from food. You are adding something or removing something from the food so that natural composition and quality of food substance is affected. Okay. Either it is intentional by someone, removing by intentional, or additional is also intentional or unintentional, it is adulteration. Okay. When you say that food is adulterated, a substance is added which depreciates the or injuriously affects the food. Okay. Cheaper or inferior substances are substituted only or in part. You remove the complete what we say, food and replace the whole food. Like in honey, you completely take out the honey and you replace with jaggery liquid, or you had uh, vanaspati to ghee, that is called adulteration, or any valuable necessary constant which has been wholly or partly abstracted. It is an imitation, as it's an imitation, discolored or otherwise treated, adding colored substances to maintain the quality. And for whatever reasons, if the standard is low, then it is adulterated. Okay. Food adulteration does not happen only in liquids, it can happen in your pulses, cereals also. Okay. We'll see how it happens. In cereals, you are adding by adding mud, grate, soapstones because they look like that. Dals again, coal tar, rice, kesari dal. I'll tell the most important ones. Ghee, that is vanaspati. Okay. Milk, extraction of fat or addition of starch and water. In this, again, there is a controversy. You might say that what about the skim milk or slim milk? Okay. This you can argue with the teachers or in the Viva OC. This is a good point of discussion there. Okay. Again, ice cream adding cellulose, starch, and non-permitted colors. This is one thing. Chili for powder again containing sawdust or brick powder. Black pepper having papaya seeds. And asafoetida, you can get resin gum, sand grills. And again, mustard seeds, poppy or argemone, no one will add because it is costlier than mustard seeds. Okay. But it can be done. At least remember at least 4 to 5 examples or 6 examples so that you can write in the exams for a 3 marker. You can say honey with sugar syrup, honey with jaggery syrup, all these things. Comparison of growth monitoring and nutritional surveillance. What is growth monitoring and what is surveillance? This we'll see in a small slides. What does growth monitoring focus on? It focuses on individual children. Okay. Purpose to track the growth over time and identify the deviations from the growth. And how we do it? By regular measuring the weight and height and head circumference, chest circumference, all these things. If there is any intervention required, if there is a deviation from the normal pattern. Frequency once monthly at regular intervals. Nutritional surveillance, it is done on population or a subgroup of a population to monitor and assess the nutritional status of the population over time. Okay, to understand the public health issues. It is done by collection of data on dietary intake, nutritional status, and related health indicators like we studied in the first question. Intervention, it's done at the public health policy level and at the bigger level, broader aspect. Okay. Frequency, it is either continuous or it is done every periodic, every 5 years or 10 years. Like census is done in once in 10 years, like NFHS data is also, or SRS data is also done at least once in 5 or 6 years. Key differences again, please do remember this 6 points. Scope, individual focused, population focused. Growth monitoring is immediate individual interventions. Nutritional surveillance, even though the monitoring is done today, the intervention takes place after 1 year also. Once the results are out. Growth monitoring involves direct measures. Data collection, it is direct. It is range of data or health indicators also being collected, which are from the hospitals also. Okay. Coming to the next question, we'll see what is our poll time. Okay, another 4 minutes left for the poll. Food toxicants, toxicities, and the consequent diseases. We have mycotoxins produced by molds, aspergillus, fusarium, penicillin species. What are the toxins they contain? Aflatoxin, ochratoxin, and fuminosin. Effects: they cause liver cancer, mimic the hepatitis B infections, and they affect the renal function and carcinogenic in nature. Aflatoxin, again, please remember Viva question, carcinogenic in nature. Cyanogenic glycosides found in cassava, bitter almonds, flax seeds, stone fruits like cherries, apricots, and peaches. Amygdalin and linamarin are the toxins, causes digestion imbalance, causing acute poisoning with symptoms like headache, dizziness, and severe cases. It might cause respiratory failure or death. Okay. Chronic exposures may affect thyroid function also. Remember the toxins, amygdalin and linamarin. Apart from this, we have pesticide residues. Pesticide residues because of the most of the because of agricultural practices. You said exactly not agricultural practices, unregulated agricultural practices where they use fertilizers and pesticides, insecticides, all these things in an uncontrolled or a unscientific way. Health effects: chronic exposure causes cancer, reproductive issues already in place in India, endocrine disruption, and neurological effects. Again, heavy metals, uh, mercury in fish, Minamata disease is the most common thing, cadmium in leaf, greeny vegetables, lead in water, and soil grown crops. Where do they come from? Industries. Okay. What do they cause? Mercury, again, nervous system. Lead causes development and behavior problems. Cadmium, kidney disease, and bone demineralization. Okay. Histamine, very rarely, so I will not touch more on this. Scrombotoxin, okay, from fishes like mackerel, tuna, and sardines because they are not stored properly. And we have a beautiful biotoxins also in this slide. Those are ciguatoxin, saxitoxin, and domoic acid. What do they cause? GI disturbances. Paralytic shellfish poisoning causes paralysis, can be fatal. And the most beautiful one is this amnesic shellfish poisoning, causing memory loss and neurological symptoms. Okay, these are produced by algae and certain fish. Phytohemogglutinin, those are lectins. These are found in uncooked beans, particularly kidney beans. So a little bit bigger one. Health effect: they can cause red blood cells to clump together and cause GI symptoms, nausea, vomiting, diarrhea. Happens only when they're not cooked properly. Okay. Now I'll be ending the poll. It is already 10 seconds short of 15 minutes. And last question for today is vitamin A deficiency, that is xerophthalmia. Okay. The signs of vitamin deficiency are predominantly related to eyes, to your vision. They include these five. Please do remember these five. These five will be asked from here: community medicine, pediatrics, obstetrics, medicine. All four things will be covered in this, and also your ophthalmology, the most important one. Okay. The term xerophthalmia comprises of all the ocular manifestations because of vitamin A deficiency, starting from here to here. This is the spectrum. Okay. Night blindness. What does it mean? Inability to see in dim light, evening and nights. As simple as that. Even mother, when the child is young, even mother cannot identify the sign or the symptom, whether the child is able to see or not. So it is better you start off with vitamin A supplementation at 9 months. Conjunctival xerosis. Right? That means the conjunctiva is usually wet, okay, but it becomes dry in conjunctival cirrhosis. Bite out spots, there are triangle, exactly not triangle, it was somewhat quadrilateral types. Pearly white, yellowish foamy spots on bulbar conjunctiva, okay, on either side of the cornea. Either side of the cornea, not on the lateral and the medial side, there's no specificity. It can be seen on either sides. Okay. Corneal cirrhosis, usually your cornea is shiny, reflective, moist. Okay. But in corneal cirrhosis, it is dull, dry, and non-wettable. Once this happens, when you blink your eyes, the eyelids come and uh, close over the cornea, which causes abrasions and which may lead to ulcer. And this ulcer will affect the vision. Okay. Next, we have keratomalacia, which is a very serious condition. There is a liquefaction of cornea. It is a grave medical emergency. Why? Once the cornea bursts out, the eye collapses and the complete loss of vision is there, and it is happens very rapidly. It is a very rapid process. Okay, it happens like this in matter of minutes. When do we say that xerophthalmia is a problem in the community? Okay, criteria is this, and prevalence in the population in the age group of 6 months to 6 years. If the night blindness is more than 1% of prevalence, then it is a community problem. Bite out spots more than 0.5%. Corneal cirrhosis, ulceration or keratomalacia more than 0.01. Corneal scar again 0.05%. Is an invasive or a lab method if serum retinol less than 10 microgram deciliter in more than 5% of the children, then you say that vitamin A deficiency is a community problem in the particular community. Okay, this table has to be remembered for your exams. They might ask in Bible also. With this, we have completed the class for today. Thanks for watching. We have social media handles, that is on YouTube, Instagram, Facebook, and Telegram. Download the app on Google Play for Android users and App Store for iOS users. Thanks for watching. See you in the next class.